With me now is Mohammed Amida-Deen. He's the mayor of Teaneck, New Jersey. Mr. Mayor, I said I wanted to keep checking in with you. This morning, my producer was telling me after exchanging some back and forth with you that you felt like good news is maybe overhyping things, but you finally had a day with not as much bad news, that there is some evidence that social distancing is working. Explain what you're seeing.
Well, thank you for having me. I think that we were 5 days ahead of the state asking for a lockdown. And what we're seeing now is we're seeing it slowly climb. And just like the previous guest said, that we're not seeing that exponential growth that's happening in our town. So hopefully the graph is showing that we have like 15 to 25 cases every day that are going up, not the 50 to 100, the big exponential jumps that is happening throughout the country. Signs of good news is, the CEO of Holy Name Hospital, who was tested positive, he's back to work. Our first case or one of the first cases in Teaneck was Dr. James Pruden, who was an ER doctor in Paterson, New Jersey. He seems to be recovering. So we do have some good news in regards of not only the numbers, but people who are recovering.
Mm-hmm. Let's talk about your supply. Right. No, I know. I want to talk about your supply situation.
The supply situation is still day to day. Every day, it seems that, we're fighting for more and more masks as well as everything else. The governor just ordered in his press conference today, said that we have 800 ventilators coming to New Jersey. We still don't know exactly when they've been delivered, but we're grateful they're on their way. I think people need to understand that, we needed to move faster. We need the federal government to move faster, is what we're saying. On the 17th of March, CNBC reported that there was 2,000 ventilators ready to ship. Yesterday, CNN reports that they don't know where to go. So again, being on the front lines, it's very difficult, especially, in a town like mine where we have had, about a dozen deaths.
Walk me through how you make a request. Do you feel like you go through the state? Do you have a point of contact at the federal government? Explain to me how you go about asking for a resource that you need, that you think the federal government has to be the one to do it. Do you go directly? Do you have to do it through the governor? Walk me through the bureaucracy, if you will.
The bureaucracy, we have our Teaneck OEM that asks the Bergen County OEM, that asks the New Jersey State OEM, who asks the federal government and their agencies. And that's the chain of command that happens. Now, again, if your house is on fire, you're not going to wait for the fire truck. You go out and you get water and you try to figure it out. So, I've been shaking every tree, everybody that knows somebody in the White House, somebody who knows somebody in the Senate. I mean, I'm very grateful. Both my U.S. senators, I have their cell phones. They take my call. They try to do the best they can. My Congressman, Josh Gottheimer, there's never been a time where he doesn't get back to me within the hour if I ask for him. And the same thing with the governor. I think that the plan just needs to move faster. I mean, here in New Jersey, not only is a ventilator problem, but Dr. Jarrett, who was on that same program with me, talked about, we need ICU nurses, right? So if we know we're going to have an ICU nurse shortage and we're not going to have respiratory therapist shortages, all right, there's 11,000 nurses in the U.S. Army. We couldn't deploy 10% of them to get ready. I think that, where the places aren't hard hit, if the manufacturing line is started, with GE, okay, let's go to these other states that have ventilators and bring them over here. And, when they need them back, we'll give them back if we can. But, there needs to be like a sense of urgency of what's going on in the East Coast, because I think just like you see in Florida, they just started today. This is coming to a town near you. And if you're not prepared, you're going to be caught behind and it's going to cost people's lives. And that's what I really wish that, people get this out there. Social distancing does work. That's your only way to fight this right now. It's not the drugs. It's not some magic test that's going to come. Again, like previously, we need a lot more testing, right? So where are these Abbott tests that we talked about on Tuesday? I'm told that we have these in Bergen County, but they're not deployed. And why haven't they been deployed? So there needs to be like a streamline, a czar, or somebody needs to take control of this, like somebody who has Army experience. If you're going to call it a war, treat it like a war. And if you're going to treat it like a war, then have a soldier on the front line.
Now, the last administration used Russell Honore who plenty of military experience to run the recovery in the Gulf Coast. It does seem as if somebody with military logistics experience. I mean, you've just made an incredible case, Mr. Mayor. I hope the right people were listening, because you just made a great logistics argument about what is needed right now. Not a left, not a right, just a logistics argument. Mr. Mayor, good luck to you, sir. Thanks for coming on and expressing your views with us. I appreciate it.
Great. Thank you for having me.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.